All right, so you've probably seen in the news or some other social media source out there that there's this biggest Medicare fraud takedown in history. 324 people charged throughout the United States, and some people charged from overseas. $15 billion involved. I want to be cautious how I say that because I'm going to get into the details. 15 billion, really? A global conspiracy and a shiny new name, the Operation Gold Rush, because of course anything with this administration is always about gold, right? Everything's got to be, couched in the word gold. All this sounds impressive, right? Well, until you find out the truth. So we're going to talk about the truth here today, that it wasn't a single coordinated bust. It was a pile, a whole bunch of separate cases, many of which have already been investigated, many of which have already been indicted. Some have already paid some restitution. Most of the money has already stopped. There's some people that are already in jail for this under the previous administration. So this is a multi-year, this is not one big package, 324 people in one conspiracy. This is a whole bunch of different cases. And what happened is the administration said, what's in the pipeline? What cases? We've got a case over here. We've got a case over there. Well, that one's already done. Let's go ahead and pull this one out there. This one right here is still in the process. Has been working on for 2 years. Let's go ahead and pull that. We'll pull all of this together, slap a cool little name on it, Operation Gold Rush, and then we will take credit for it. Why now? Why the publicity stunt now? Is it a coincidence? Those regular viewers to my channel know this is probably not a coincidence. It's because right now they have the big, beautiful bill. It's already passed the Senate. It's in the House today, and they've been working on it for a while. And they, in order to pay for tax cuts for the big corporations and the billionaires out there, they have to cut health care for the rest of us. That is Medicaid, Medicare, and the Affordable Care Act. So this is an attempt to say, hey, we're good in cutting all those things because, hey, it's fraud, waste, and abuse there. And we found it, and we're so awesome that we found all this stuff. Again, a lot of this has already been happening for years. These investigations, I know I ran the third business Social Security office in the country. And these investigations, who started these investigations? Y'all did. So I'm going to show a clip of Dr. Oz and the video, the announcement, it's kind of political theater, if you ask me, was a lot longer, but I narrowed everything down to about 5 minutes, and I'm going to give some warnings out there. Some of you are going to be very, very angry. So if you watch this short little clip, like it's about 4 minutes or so, I'm going to talk about it. If you watch this clip, please don't throw your phone up against the wall and break it. If you're watching this on the TV, move your shoes and everything out of the way so you don't have to throw it at the TV because you're going to be very, very angry. This is unbelievable. Some of the stuff that he is saying at the same time they're trying to cut Medicare and Medicaid. And for those new to my channel, for those that didn't join me yesterday, I talked about this yesterday, so you can watch my video yesterday. We talked about Medicare cuts, and I'm sure people that didn't watch my video yesterday are saying, Ed, you're an idiot. There are no Medicare cuts in the big, beautiful bill. Well, there are a little bit, but the big ones come from the PayGo Act that was passed in 2010, which basically said if a bill causes a deficit, then you automatically have to cut something. And the thing that they have to cut is Medicare. And it's interesting, Dr. Oz does I think a Freudian slip and mentions that. So Medicare is on the table. And obviously Medicare as well. The bureaucratic disenrollment is probably the biggest one. So there's about $1 trillion that's going to be taken out of Medicaid. And, the whole argument is it's fraud, waste, and abuse, or it's some 26-year-old kid, in their parents' basement playing video games. Yeah, that's not $1 trillion. A lot of this is bureaucratic disenrollment where people, they are unable to navigate the bureaucratic red tape, and they lose their health insurance. They lose their Medicare. they lose their Medicaid or they lose their Medicare savings program. That's going to be a lot out there. And if you've got any questions about that, this is also a live Q&A. I've already got tons of questions as well about all things Social Security. So I'll continue to talk about what's going on in the news here for about another 5, 6, 7 minutes. And then I'll get into all your questions. And I've also got some video questions that people sent in about retirement benefits, survivor benefits, Medicare and Medicaid, and all the rest of it. So we'll talk about those as well. But let's get into this announcement by Dr. Oz. So let's kind of calm down when we watch this, or a lot of people are going to get very, very angry. So, and I'll talk about this as we go. And I've edited a couple of clips, and I put them on repeat. And a lot of you will notice the irony here.
We are announcing today charges against 324 defendants for their alleged participation in healthcare fraud schemes involving approximately $14.6 billion in false claims submitted to Medicare, Medicaid, and other healthcare programs. As just one example, we dismantled a scheme involving a sophisticated operation run from Russia and Eastern Europe that strategically bought dozens of medical supply companies in the United States and submitted more than $10 billion in fraudulent healthcare claims to Medicare.
They always have to throw some type of international conspiracy in there. Again, this is a whole bunch of different cases, but yes, I hate to break the news to you, but fraud, waste, and abuse does exist. And at the end of this, Dr. Oz says, we need your help. And definitely that is 100% true. If you go onto my YouTube description page on this video, you'll see a number at the bottom, 1-800-MEDICARE. So how we stop all this Medicare fraud is y'all. You see something that you think is fraudulent, call Medicare. And then also Dr. Oz gives you another option as well. But you'll notice that he mentions billions of dollars. 10, 15 billions of dollars. Majority of this was already stopped under the previous administration. But if you watch the entire, it's about an hour long, this press conference, you'll notice they never give any dates. They never give any dates. So they don't say, this is an investigation that we began back in 2023. This is an investigation we began back last year. They never give any dates. It's very suspicious. Well, we know why.
To make matters worse, these perpetrators used the stolen identities of more than 1 million Americans spanning all 50 states to perpetrate this scheme and submit these false claims.
Let me put on my clinician's hat first, because it is my culture, my story. I'm a heart surgeon. And when I hear about this fraud, I think about patients who have trusted us, people who are at their most vulnerable time looking for the protection of our services. And too often these criminal entities have tried to pierce that trust. When you walk into the Health and Human Services building not far from here, there's a quote from Hubert Humphrey, from whom the building is named. And it says, "It is the moral obligation of government," that's what we're doing here today, "it's the moral obligation of government to protect those who are at the dawn of their life, our children, those at the twilight of their life, our seniors, and those living in the shadows, folks who are having trouble, like the substance use disorder mentioned a second ago by Juliet." I want to applaud all the agencies that collaborated today, because when President Trump signed the executive order on fraud, waste, and abuse, a pledge to crush this reality. What you're witnessing on stage today is exactly that. The American government at its best, making sure all of us work together for the same common purpose, in this case, especially, expressly to protect those who are our most vulnerable. Because all great societies are judged by how they take care of those who are vulnerable, and we are great people.
One more time.
All great societies are judged by how they take care of those who are vulnerable, and we are great people. We will do that. All great societies are judged by how they take care of those who are vulnerable, and we are great people. We will do that.
All right. At the same exact time, they're cutting $1 trillion from Medicaid. At the exact same time, they're about to unleash a deficit, which will cut health care for those receiving Medicare. At the exact same time, they're rewriting the rules for the Affordable Care Act to essentially price people out of health insurance. Yes, he is 100% correct. A great society is defined by how well we take care of those most vulnerable. That is exactly, yes. But That's definitely not
When it's
happening
not
now.
done by small-time operators. As you're hearing about and you will read about, these are organized syndicates who are designing to hurt America. And why do they hurt our healthcare system? Well, CMS is probably the largest target of all, responsible for about $1.7 trillion of disbursement. So it's a big target on our side. So it's a big target on our side. So it's a big target on our side.
I think that's a little bit of Freudian slip. I think he's going to regret that in the future. I'm sure someone else is going to take that out and says, okay, yeah, it's a big target on our side. We need to give trillions of dollars to tax breaks to build millionaires and billionaires. So where do we find that money to offset? Because the way they're passing it is through reconciliation. So they have to find some money somewhere and then, play with the numbers. So where do they find that money? They're looking at the most vulnerable. They're kicking people off healthcare, Medicare, Medicaid, the Affordable Care Act, food stamps. So they're definitely not taking care of the most vulnerable. And yes, the big target on their side is those people that receiving health insurance. So
there are modern tools being used to attack us.
And here is the justification to why the government needs more AI to monitor us. Got to throw that in there too, don't we?
We need even more modern ways, including AI, which I'll speak about in a second, to take them down. The oversight has to be unrelenting. The CMS fraud war room that I want to announce that Kim is going to lead is an effort as an example of this. It's prevented most of the fraudulent efforts to take money out of our agency. So most of the money never left the door.
So he said, I just started the war room, the fraud, waste, and abuse war room. And all of that $10-15 billion, a vast majority of that, that person on the left will talk about here in a second, is $2.9 billion. That's just a lot of money. So we all need to join together and make sure, fraud, waste, and abuse, those pill mills out there and the people doing, surgeries that are not needed, the people that are doing, the old rascals, the low motor scooters. That was a big scandal. Medicare shut those down, which is unfortunate because some people actually need those and they really have very, very difficult time getting them now because, one group ruined it for everybody else. But most of this money was already stopped. Most of the money was already stopped, and that was stopped the war room isn't even started yet. Most of the money was stopped, the money going overseas. That money never went overseas because it was stopped during the previous administration. It was stopped, the Department of Justice, the Office of the Inspector General, and, the current administration, those people are going to continue to do the same thing, stop that. But to take credit for that, it's kind of like, a second string quarterback coming in at the last 2 minutes and when the game is already way ahead and then gets a touchdown and then you win it 44-0 and you're like, wow, it's because of me. Wait a second. That's, the game was pretty much already over.
The money was never stolen, even though we know you were trying to do it. And when I speak to you, when the president signed that executive order, he put a bunch of new sheriffs in town. We need your help.
When I heard that, I couldn't help thinking some people know exactly. New sheriffs in town. Was it Reggie Hammond, Eddie Murphy from 48 Hours, Nick Nolte? Yeah, new sheriff in town. So
both to protect your own important information, don't give it away because con artists come to your door and try to get it, but give us tips. You're going to hear all of us share opportunities that we have, but it only happens in healthcare because we know we have allies, the American people. We provide care to 68 million Medicare beneficiaries. 80 million Americans are on Medicaid or CHIP. There's another 20 million on the exchanges. There are a lot of people that will come to help us. So write this down, 1-800-HHS-TIPS. 1-800-HHS-TIPS. Services that are wasteful and should not be offered to the American people because they could hurt them. And they're certainly not providing value for these wonderful Americans whose health is being taken advantage of to generate higher savings, higher revenue, rather, for providers. We're not going to tolerate it anymore. And we're going to use data analytics, real-time monitoring, and unhesitating and unwavering pursuit of the law to make sure this happens.
Yeah, and I've got a few more seconds here, kind of an ironical little twist there on so-called, the messaging of fraud. But okay, so great. $2.9 billion, awesome, great job. But again, don't take credit for it when it was an ongoing investigation, and most of these investigations already been closed out, done, and people are indicted. They just grabbed a whole bunch of papers together and slapped a new name on it. But kind of the idea of fraud really need to focus on tens of billions of dollars every year is Medicare Advantage fraud. That's where the big fraud is happening. All you have to do is Google a little bit and you can see that Medicare Advantage companies over the last few years have wasted tens of billions. I mean, not 2.9 billion, but tens of billions of dollars in upcoding, where basically what they do is they have patients under their Medicare Advantage plan and they do, they bring you into the office and they do a little thing, and then they upcode you for something else so the Medicare Advantage company can get more money. Because what happens with Medicare Advantage companies is if you are sicker, they get more money from the government. So it incentivizes them to make you more sicker, to make you sicker. So that is a humongous scandal, and that's something that's definitely going out there. And this is an irony about the messaging here about someone who was pardoned, the greatest Medicare fraud in history prior to this one. And I don't think this is going to be counting it because this is just a whole bunch of different cases kind of, slapped together. So I don't think this counts as the greatest Medicare fraud in history because it's a whole bunch of different cases. The previous one guy, guess what? He was pardoned.
Intended loss was north of 14 billion. Can you say what the actual loss was?
2.9 billion. Frankly, 2.9 billion actual loss on 14.6 billion intended loss is pretty good. It's less than a sixth, and we were able to prevent that by getting ahead of schemes early. So the best thing,
We was not this administration. Yes, this administration is doing some good things too. It's Department of Justice, OIG, the Social Security employees, Medicare employees, but the previous administration too, because all of these have been happening for years. So again, they don't they don't give credit where credit's due.
Prevention
Partly.
rather than enforcement.
Can you talk about how this AI explosion and the kind of confluence of fraud and how you're kind of marshaling resources to attack that? And separately, Dr. Oz, you mentioned that this is largely about messaging and making clear that this kind of fraud is unacceptable. I wonder, does it undermine that message when President Trump recently pardoned Lawrence Duran, who was convicted in what was at the time the largest Medicare fraud scam in history? Does it undermine that at all?
I'll start with your first question. So, yes, we are concerned about the criminals' advancements in technology here, obviously, and
guess what? He never gets to the second question. He never gets to the guy over $200 million in Medicare fraud. Guy in Southern Florida, I think it was. He was convicted and sent to jail for 50 years and about $80 million supposed to pay back. Restitution. Completely pardoned recently by President Trump. Completely pardoned. Same guy, another guy in Florida there that was convicted about Social Security tax fraud, that he took FICA taxes from his employees and just kept it and, bought some boats and stuff like that. His mother gave $1 million to the Mar-a-Lago party, and he was pardoned as well. So, yeah, this is not good in terms of, messaging. We want to cut down on fraud, waste, and abuse unless, anyway. So this Operation Gold Rush, 324 arrested, indicted, 14 billion of fraud, global conspiracy, but it's a big photo op. And the investigation started years ago. These investigations, they just take a long time, unfortunately. Many arrests were already made. A lot of the money was already seized and never stopped. So the fraud is real, yes. So don't get me wrong, there is fraud. My office, third busiest office in the country, we found a lot of Social Security fraud and Medicare fraud. We sent our bulldogs, the Office of the Inspector General, after these people. And, some were sent to jail, paid restitution and all the rest of it. But this is essentially a publicity stunt, political theater at a particular time when our benefits, our Medicare, our Medicaid, our Affordable Care Act is at the most vulnerable. So we have to keep that into consideration. We have to kind of recognize that and reach out to our politicians and say, hey, what's going on here? We need to stop that. So, all right, let's go ahead and we're going to get into some of your questions. I got tons of questions here. I'm going to grab some at random. At the end of 2024, our Medicare was hacked through United Healthcare accounts in Oklahoma through Ascension Hospital. They kept rebilling us, then our bill was credited and we couldn't get into our account. Wow. Yeah, that's, one of the good things on, Medicare. I know Social Security, that you hear a lot of, Social Security numbers being out there all the time, but it's usually some, department store or credit reporting agency or something like that that exposes all these Social Security numbers. Knock on wood, Social Security itself, the Social Security Administration has always done a really, really, really good job of protecting people's private identity or private, PIA, as we call it, personally identifiable information. I'm not sure how it's going right now with Doge in there. Yeah, we don't know exactly what's going on there. But hopefully that hack there was found out by people. Again, this is the key. And do you think I used to really respect Dr. Oz? He should have just stayed out of this political circus. Yeah, I think, he used to definitely sell Medicare Advantage plans on his website, which is good for a lot of people. But you should always check out Medicare supplement plans first. Check out all your options. But, once you get into the political sphere, then you really have to toe the company line. That's why people, sometimes, not sure, but people say, Ed, you should get into politics. I'm like, no, I can't toe the company line at all. Says Dr. Oz needs to go back to being a talk show host. Yeah. The rich keep getting richer and the poor getting poorer. Yeah, that's definitely the fact with this massive distribution of wealth. But it's still, I checked just before we went live here, and it looks as though it's kind of wobbling a little bit in the House of Representatives. It was barely passed in the Senate. They had to add some, the House sent up a bill and very draconian cuts to the most vulnerable. And then the Senate said, hold my beer. We'll show you how to attack the most vulnerable. And they added even worse parts in there to affect those that really need our help out there. I'm so glad I don't have the Advantage plan. Yeah, if you can afford a Medicare supplement plan, definitely get a Medicare supplement plan. But unfortunately, there's a lot of people that just can't afford that monthly cost. But if you get sick, then a Medicare supplement plan actually might be cheaper in the long run. Sorry, my regular viewers, I usually show people's questions up there, but it's not working right now, unfortunately. So I'm just going to have to read here. But if you have a crystal ball, and you're never going to get sick, you're never going to get injured, fall, or anything like that, and you're just going to need the very minimum of, just checkups and stuff like that, 100% get a Medicare Advantage plan. Definitely that's the one for you, because you get one of the ones with zero premium, and you save, all that money for the next 10, 20, 30, 40 years. But, life is what happens while we're making other plans. Can you please explain how the ACA will be affected by the BBB? Me and my husband are on it and are 60 and 61 and pay $36 a month. Will our premium go up? We live in Alabama. Yes, they are going to be making it far, far more difficult for people to keep the Affordable Care Act. That's one of the tricks of all of this. People look at these particular bills, all of them, and they say, oh, okay, that's, I'm a American citizen. Oh, it's showing up on that one for some reason. Oh, okay, I figured out. All right, so I figured out why my thingy isn't showing up. Okay, there we go. All right, so I'm not the best at technology. All right. So a lot of people saying, hey, I'm American citizen. I'm actually disabled. I'm actually, retired and I can't work and all this kind of stuff, or I'm actually working, so I don't have to worry about any of this. And here's what I'm come up with yesterday. Here's going to be the trending phrases for the next 12, 24 months. Wait, I didn't think this thing had anything to do. Why didn't anybody warn us? I thought my Medicare was safe, but here's how it's going to be is called, it's going to move forward is called this bureaucratic disenrollment, where they make it so difficult. Even if you're a U.S. citizen, you're here legally and you're actually disabled, you're a senior, whatever the case may be, you're going to have to redo some of this stuff, particularly for Medicaid, the Medicare Savings Program. You're going to have to do this more often, and there's not going to be any help there. So if you get something wrong, then that's it. If you're truly eligible, you'll get it restarted, but it might take you a month or 2 months or 3 months of dealing with all the bureaucracy to actually get everything restarted. And if they're paying for your Medicare, Part B or something, you might lose out on that $185 times 1, 2, 3 months. And then you might lose your Medicare Advantage dual eligible plan, lose your grocery card. So it's going to affect, unfortunately, a lot of people out there. And that's why on my website, I am putting together, on my website, there's a lot of information about retirement disability, also about living on Social Security alone, a lot of help there, the SNAP benefits, which are going to be hurt, the Medicare Savings Program is going to be hurt, the extra help with prescription drugs, I haven't seen anything negatively on that. Medicaid is definitely going to take a big hit. Meals on Wheels is going to take a big hit. Not sure about that one. The low-income assistance program is going to take a big hit. This one, the senior community service employment, that's going to take a big hit. But I'm also going to add another page on community resources. So I'm working on that now. And what it's going to be is us, regular viewers, you guys awesome throughout the 50 states, I guess except in Alaska, because I guess Lisa Murkowski made a special backroom deal to take care of people in Alaska. But us other 49 states that really get hit and they threaten us with that bureaucratic disenrollment, we're going to come up with kind of some insider tips, tricks, and secrets to make sure you do everything correctly so you continue to get your Medicaid and your Medicare Savings Program, your Affordable Care Act, and all the rest of it. So make sure you subscribe, like, share, and all that kind of good stuff, and we will keep you up to date. And we're going to keep an eye on this and find out exactly what happens to the bill, and that way we can come up with a plan of attack to make sure we help as many people keep those benefits. So, okay, here we go. We're fixed. If I retire and start Social Security in December 1st, check, and in January, and still get maybe 2 more works checks after I leave, do I need to stay under the limit of $29.50? FYI, I do give the Medicare supplement. Okay, you do have the Medicare supplement, the Medigap, like a Plan N or a Plan G. So awesome, good. As long as you can afford it, keep it. Okay. All right. So if you start your Social Security in December, so that means you're starting in December. So this is your first year. So you can do the monthly earnings test in December. So you have to stay under $23,400 for the year for this year. If you're going to be over $23,400, no problem. You just have to stay under $1,950 in the month of December, because you're going to get your December check, but it's not going to come until January. Your December, they always comes a month late. December comes in January, January comes in February. But December, they can do the monthly $1,950. But next year, you have to stay under the annual earnings limit. And we don't know what that is. It's probably going to be $24,000, $25,000 or so. And there was someone, I spend so much time, we spend so much time on this channel correcting all the other social media. There was I'm not going to try to identify this person, but they did a really good video, really good edited and everything like that, and about this monthly earnings test and the annual earnings test and everything, and they completely misinterpreted it, and they did a really nice video, about 20 minutes, but it was all wrong, and there was about 20,000 people that watched it, so I chimed in there, I went in the comments, and I'm like, sorry, this is completely wrong. And credit to this person took it down. So, she spent all that time on a nice little video, all edited. None of my videos are edited and pretty. They're all live, as you all can see. So, yeah, raw and acoustic and unplugged. But credit to this person. She took it. Oh, I said, yeah, I didn't want to give any indication. Okay, it was taken down. So, but yeah, so that's how it's going to work for you. Kai, did you forget to take your message? Okay, someone's all right. Someone I saw earlier when I was talking about the fraud political theater, that people said the annual earnings limit should end. It's all BS. Okay. I can see what you mean. It's your money, but yes, it is your money. It is your money, but there is the annual earnings limit, the monthly earnings limit when you first start your benefits, if you start your benefits early. Okay. And goes back all the way to 1935 when FDR started the program. Social Security is supposed to be a replacement for lost wages. So, but if you're not losing those wages, you just decide you want to start your benefits early at 62 rather than, it used to be the full retirement age of 65. But it's not lost wages because you didn't lose your wages. You're going to continue to work. So that's why there's the annual earnings limit. You might agree with it, disagree with it, whatever the case may be, but it's been around since, 1935. So. Let's see here. I've never felt so uneasy about everything happening, and there's a whole lot of crap. Yeah, this is the most, one of the most worst pieces of legislation we've seen in decades and decades and decades. I really hope it doesn't pass, but it doesn't look good. Vicky, I really wish they get this all finished because I'm on oxygen 24 hours a day. I have a big machine here that I certainly cannot afford without insurance. All of this is very scary. Vicky, just, call your representatives, your senator, your House, your Congress people, call them, make sure they know how you feel, and then just go on with your life and let it fall where it may. And just, I will keep you up to date and exactly what happens eventually and what we need to do to make sure, everything continues. So for now, just reach out, call your politicians, and then go on with your life. So Dr. Ed said he lived in Pennsylvania to run for office, but he was using a relative's address. He lived in another state. Yeah. Dove Eyes, I was told when I received Medicare B that I could stop it at any time. Now I'm hearing I lose my Social Security if I cancel B. No, you can stop your Part B at any time. Yep. But as we used to say in the Marine Corps, you can do anything in life, but there are repercussions. If you stop your Part B, if you stop it because you obtain creditable healthcare coverage from current work. So you go back to work or something and you get health insurance from work, from current work, and your employer has 20 or more employees, you or your spouse, then yeah, you can start Part B and then sign up for it in the future once you stop receiving that creditable coverage from current work. No problems whatsoever. But if you just stop it because you just want to stop it, because you don't want to pay the $185, then if you change your mind next year, 2 years from now, 5 years from now, then you'll have to pay that penalty. And it's a 10% penalty every 12 months you did not have Part B when you were supposed to. And then you can't sign up until the general enrollment period, which is January, February, March. So it's all a nightmare. If you're having a hard time paying for the Part B, this is the Medicare savings program that I talked about a little bit. The Medicare savings program is it's on the living on Social Security alone part. The Medicare Savings Program is basically you apply for Medicaid from the state, whatever your state calls it, Apple Care or Medi-Cal or Sooner Care, Access in Arizona, whatever they call it in your particular state. And that's another problem there. Is so many states call Medicaid differently. People say, hey, I don't care. I'm not on Medicaid. I'm on Apple Care or Denali Care or Access or Medi-Cal. I'm not even on Medicaid, so I don't care what they do. And then what do we go back to? Oh, why didn't somebody tell me? I didn't know it was going to affect me. This is an unfortunate part. So you apply for Medicaid from your state, and if you're approved at the higher levels of Medicaid, there's different variables, different levels of Medicaid, then they will actually pay for your Part B premium, the $185. So it's called the Medicare Savings Program, and that one probably going to take a hit there through either cutting back on Medicaid or when they start cutting back on Medicare once this debt starts to show. And then there's another way. If you are the Medicare Advantage plans, if you have a Medicare Advantage plan, there are certain plans called Medicare Advantage Part B Give Back. And those Part B Give Back, as the name implies, is a Part B give back. So it might pay part or all of your Part B premium. So you can check out, you can call chapter there, whoever, someone you know and trust, and they will see if there's any of those Part B give backs in your particular neck of the woods. You might not be able to switch to one of those now. You can only switch your Medicare Advantage plan during certain times. If you move, you can switch. If you lose Medicaid, you can switch. If you gain Medicaid, you can switch. There's some other special enrollment periods. But predominantly, most people can't until October 15th. So if you want, you can call chapter and say, hey, put me on the list for, October, November, December 7th is the final day. Put me on the list. Let's talk then and see what's available for 2026. Because I think it's going to be crazy for 2026. Again, to be a politician, you would have been a lawyer, a big time wannabe criminal, or a very good comedian of pure insanity. I think I got that last. A comedian, I make myself laugh. Does that count? But I got the insanity part. I was a sergeant in the Marine Corps, so I think I'm clinically diagnosed as insane. Yes. I paid into Medicare for 40 years, and they take $190 a month for my disability. How can they take all that away? That's taxation without representation. Yeah, that's everybody. So $185 a month. Everybody has to pay Part B, unless, again, you're getting Medicaid to pay, or you have one of the Medicare Advantage Part B give back that pays part of it. Yeah, but everybody pays the $185. So Medicare Advantage better than regular Medicare? Doubt it. Yes, I agree. But is Medicare Advantage better than regular Medicare? Yes, if what you mean by regular Medicare alone. So if all you have is Medicare Part A and Part B, Medicare Advantage is better than that, because unless you've got a few $1,000,000 sitting under your mattress somewhere, because there's a lot of gaps. There's 6 big financial gaps in original Medicare. The big one is 20% co-insurance for Part B. So if you have $100,000 surgery, you have to cough up $20,000. So Medicare Advantage is better than having nothing at all, just Part A and Part B. If you mean Medicare Advantage is better than having A and B with a supplement, I would agree with you there. As long as if it's in your budget. If it's in your budget, then it's in your budget. But if it ain't, it ain't. But 51%, over 51% of people choose a Medicare Advantage plan. Most of the time they do it because it's a budget issue, but other times they do it because whoever helped them sign up for it didn't tell them about Medicare supplements and Medigap plans, because Medicare insurance agents and companies make more money enrolling you in a Medicare Advantage plan. It's terrible. That's why I reached out to chapter, my son and I, and they help you and give you all your options. Then you decide whatever you want. So they give you all your options, inform you of all the different things and whether you can change now and all that. Vicky, this is where Democrats need to speak up and jump on this right away and show the dates when this was investigated. Yeah, that's. I checked to see if any journalists out there really caught this, and it's not really being advertised. There's some very, very small time, small articles about this. But yeah, it's political theater. It's a distraction. Oh, look, yeah, I guess it's okay to go ahead and cut Medicaid and Medicare and the Affordable Care Act because it's all rampant with fraud anywhere. Look at all that, 15 billion. It's like, okay, it wasn't 15 billion, it was 2.9. Most of it was already caught. And here's an important thing. Here's the options for fraud. Does fraud exist? Of course it does. Come on. Right. Here's the issue. Medicare addresses fraud differently than, let's say, the alternative, which is a Medicare Advantage plan. Here's your options. A Medicare, if you have original Medicare with a Medicare supplement, you have original Medicare. And you go to a doctor, and the doctor says, you need this. It's medically necessary. Done. Finished. If it's medically necessary, the doctor doesn't need prior approval, prior authorization, permission from insurance company. It's medically necessary. Done. What do you mean medically necessary? If I go in there and says, hey, I need a hair transplant, they go, yeah, sorry, Ed. Yeah, it's not medically necessary. I'll make my case, but they'll deny me, right? It has to be medically necessary. And if you look on, there's a really good app. It's what does Medicare cover? There's an app, an official Medicare.gov app that shows you what it covers and how many percentage and all that kind of stuff. So definitely check that out. So Medicare, they don't get in between you and your doctor. If doctor says you need it, you need it. How they come up with fraud, like they did these 324 people, is y'all drop the dime on doctors. You know, you have a cousin that goes to a doctor and you can see that doctor is doing something not so good. You call up 1-800-Medicare or the Health and Human Services number that Dr. Oz gave, and you drop the dime on it. And then Medicare goes in there and investigates that and then throws that person in jail and makes them pay restitution unless they go to Mar-a-Lago. And so anyway, but that's how that's done after the fact. They don't get involved with you and your doctor. Medicare Advantage plans, they do it the opposite way. You won't see these big giant investigations with Medicare Advantage like that, because what they do is they get in between you and your doctor. That's how they stop it. They stop it on the front end. Doctor says you need this. The doctor has to submit that to the Medicare Advantage plan, and they, you know, supposedly a doctor in the Medicare Advantage plan is supposed to look at it. But there's been some scandals about AI denying stuff, and that's where the real scandal is all the billions of dollars of healthcare that you paid for all those decades you paid into FICA. That's your money that Medicare Advantage plans are holding for their own profits by denying you. That's where the real scandal is. So those are the two options. You either catch it after the fact and don't get in between you and your doctor, don't delay treatment or whatever, or you go the other way and you hope the bean counter at the health insurance, the accountant, makes a good medical determination. So, do you believe that people who was born disabled should always be on Medicaid for the rest of their life? Whether it's Medicaid or Medicare or Affordable Care Act, yeah, I believe people that are disabled, we need to take care of them. Absolutely. I think Dr. Oz is 100% right. A definition of a good society is how we take care of, the vulnerable. Yes, 100%. Healthcare. Yes, they should be able to get the healthcare they need. I think healthcare it should be a right, but that's just me. No tax on tips and overtime is only good for 4 years. They neglected to tell people that. Yeah, and it's not even, on the tips, it's just, you still have to pay it, but then you catch it up on the other, and there's a gap, and there's a limit of 25,000 and stuff. So, yeah, but it's only good for 4 years. But the tax breaks for the billionaires, yeah, those are permanent. So, wow. Rick Scott needs to go retire. Oh, speaking of alleged Medicare fraud. Well, he convicted anyway. So yeah, talk about. How would I get a grocery card? Okay, those are tied to those Medicare Advantage dual eligible plans. They used to be tied to a lot of others, but this year they kind of changed it around. It's mostly for the dual eligible plans. So to be dual eligible, you have to have Medicaid and Medicare. So if you have Medicaid and Medicare and the higher levels of Medicaid, then you can get what's called a Medicare Advantage dual eligible plan. And those are the ones with, $100 a month, $200 a month, or whatever grocery cards. And they do exist, but the way they're advertised out there is really, really scammy. There's companies and, insurance agents and insurance companies out there that, go on Facebook or social media and they say, hey, there's a, $300 grocery card, call us up and, let's see if you can get one. And it's only like in one area of the country, Paris, Texas. It's only like it's not Paris, I'm just making this up. It's only in Paris, Texas that you can get this $299 grocery card, but they advertise it to the entire country and everybody calls them and then they do their hard sell. And so they got you and they got your information. And then once they get your information, then they sell that information to everybody else. And then everybody else starts calling you and harassing you 40 times a day. So that's how that happens, which is completely illegal. They're not supposed to do that. Not supposed to do that. So the governor was bragging about how efficient the alligator moat is, said fly them in, process them, paraphrasing one and done. Yeah, the alligator Alcatraz, yeah, that's not good. That There's gonna and because they're, you know, all right. I'm just gonna leave that at that. That's gonna come back and haunt us. I guarantee it. All right. I've got I've got 4 people that sent in video questions. So let's get into some video questions. I'll answer those now.
Hi, I am guardian for my brother who is 67 and who is mentally ill and has been since he was a young man. He is being released to a foster home, and I was told that I need to apply for SSI for him. I'm not sure whether to do it based on a disability or based on age. Thank you.
All right. Good question. So SSI, the Supplemental Security Income, which is the welfare-based program the Social Security administers, low income, low resources. Everybody always confuses SSI. They think it means Social Security income. No, it's Supplemental Security Income. It's a welfare-based program the Social Security Administration took over in 1974. So celebrated 50 years last year. So anyway, SSI aged, you can get it based on 2 things. Either SSI aged, which 65 or older, or SSI disabled. So if you're under 65, when you file for SSI, they do it disability. You file for SSI disability. So if you ever file for disability, they always take both programs. So if you file for Social Security Disability, SSDI, they take an application for that, and they also take an application for the SSI part to see if you're eligible for that. And so there's always a lot of confusion there. But if if he is 67 years old, it'll automatically be SSI aged. So just call Social Security and say, I want to apply for SSI, and they'll know by his age, it'll be SSI aged. So thank you for taking care of those around you. You are too awesome. We love people like you and in our community here.
I'm 71, and I've been on SSI for a long time. But now I'm on both SSI and the Social Security from survivors' benefits, but that's just a little portion. It's only $300, so the majority of my money still comes from that SSI part. Now that I'm 71, can I sell something like on eBay without them taking that money from me? Or am I still sequestered to the rules that if I make a penny, they take a penny, or they take a half a penny? Because if in the past, if I borrowed $100 from my ex, they took $100 away from me. It didn't make sense. It doesn't make sense. I can't make ends meet this way.
Okay, yes, thank you for the question. Okay, so this is SSI. You can get, just as she's getting SSI and other benefits. So you can get SSDI, Social Security Disability Insurance, and SSI. You can get survivor benefits and SSI. You can get retirement benefits and SSI. You can get spouse benefits and SSI, just as she's getting. So SSI, the most you can get this year is $967. So her survivor benefits are $300. So they take that, and then they give her up to $967 for the remainder, up to $967. So in terms of the retirement, that $300, you can work right now, make $1 billion a month. It doesn't affect your survivor benefits because you're past your full retirement age. Okay, but the SSI, if it's income, it will affect you. So it really depends what you're talking about. If you just have some stuff around the house that you just want to sell, get rid of, that shouldn't be an issue. It depends on how much it is. So if you sell something around the house and it's $3,000 or $4,000 or $5,000, and then that money goes into your bank account, that generates an alert where your local Social Security office will send you a letter and says, hey, we just saw that someone put $5,000 in your account. What's going on with that? But if it's just small little money like that, then it shouldn't be an issue. But it really depends on the nature of it. So I would reach out to your local office, specifically say, I want to speak to my, Title 16 CS, Title 16, the Social Security Act, SSI claim specialist, and just tell them how much you're going to make and all the rest of it. On the loan that they held against you, if you did it right, they really shouldn't have held that against you because, if it's a loan, that means you have to pay it back. That's a debt. So it's not necessarily income coming in. That's just a debt you're taking on. You're borrowing money from a family member or bank or credit card, or whatever the case may be, just to get by, but you have to pay that back. And, like you said, it was a loan, so you shouldn't have to address that. And they just passed the law last year on what's called ISM, in-kind support and maintenance. They passed it first based on food and then on shelter, rent, that you could receive. Previously, if you received money from a church or anything like that for food, they kind of held that against you. But last year they changed the law. They said they can't hold that against you like they used to. So number one, I would reach out and tell them and ask the claim specialist and write it down and say, hey, on July 3rd, I called the local Social Security office and I talked to Bill, and Bill says, because I'm only going to be making X amount of money, selling stuff around the house, it's not an issue. And then number two, I would say, that $100, I would ask them about that. I say, hey, not sure how far back it was, but I would say, hey, that $100, that $50 that they, won for every, 50% they offset or whatever they offset, I would ask them about that and say, that was a loan. That shouldn't have been counted against me. So I would check out those two things and then come back and tell us how that went. Hopefully they fixed everything and you're able to, and make sure you check out my website on living on Social Security alone. I've got, and on my YouTube video, this YouTube video in the description, I've got a link to the video I did on about 50 different programs that might make your life a little bit easier. So, and I'm working on the website as well to expand that so you can help other people and other people can help you in your neck of the woods.
I'm going to talk about baby names or something tomorrow or something. Good morning, Dr. Ed. I was calling to find out about Social Security. I've been disabled since my 40s. I also have been married. My husband is 70. He collects his Social Security disability. I only get $950 a month, and he gets $2,300 a month. I was calling to find out, or doing this video to find out if I am eligible for his under family benefits. I would love to hear a comment. Please let me know. Thank you.
Okay. All right. Let me turn this off. Okay. So you're receiving disability benefits. So your benefit amount is your full PIA, your primary insurance amount. So that's important. So that's basically how much you're receiving. But you're probably receiving 900 or so, but they're also probably taking the $185. So your benefit amount might be $1,100 and some change or something. And your husband, I think you said, was receiving about $2,300. So your full benefit amount has to be less than half of his full benefit amount, not how much he's receiving. So let's say he's 70 years old. He just started his benefits at 70. That means he got the delayed retirement credits. He got the 8% every year added on. So if he started at 70, he'd get 24% added on to his basic primary insurance amount. And that's the number you have to go after. So yeah, it looks like it's close there, depending on when he filed and if you're getting Medicare taken out. So to make everything easier, I would just call Social Security because you want to know the exact numbers. So you can have him there. It sounds like you're still married. Just have him there. And you say, hey, I want to see if I can get some money off this dude. And you give him the Social Security number and whatever, or put him on the phone and they'll, check his record and see if you're eligible for any benefits on his record. So, and if you're divorced, he doesn't need to be there, obviously. Then the same situation. You just call and give Social Security the Social Security number of that person. If you don't know it, just tell them the name, the date of birth, the age, as close as you know it, where they were born, and the Social Security employee can find it. No problem whatsoever. And you just say, hey, am I eligible for any spouse benefits on this person's record? And they will do the quick calculation. It takes them about 2 seconds. And if there's any more money, they will set you up an appointment and get you their money.
Hi, this is Dan in Charleston, South Carolina. My question today is, I'm currently receiving survivor benefits. I'm 61, so at 62 and beyond, I could opt to choose instead my Social Security benefits. My question is simply, is there any impact on my Social Security benefits by receiving these survivor benefits currently? In other words, if I suspend my survivor benefits, will my Social Security at, say, 67 or 70, will that amount be any greater than it would be if I take these survivor benefits? Is there any impact whatsoever? Thanks for your time.
Okay, another great question. All right, I like it. So this is going to help a lot of people out there as well. Okay, so with spouse benefits, current spouse benefits, divorce spouse benefits, if that person is still out there alive and kicking, you have to file for benefits on your own record and then file for the spouse benefits. With surviving spouse benefits, divorce spouse, surviving spouse benefits, widow benefits, widower benefits, all basically the same thing. You don't have to file for benefits on your own record. So you started receiving survivor benefits at 60, 61. So, and you can't receive benefits on your own record until 62. So the benefits you are currently receiving as a surviving spouse has no effect on your benefits on your own work record. So here's a strategy. It depends on how much your benefits on your own record. So you can continue to receive surviving benefits, surviving spouse benefits, and don't touch yours and let yours increase every single month until they're at a level that you want to jump on. And that benefit on your own record will continue to increase until you hit 70 years old. So make sure you don't wait till after 70 because it won't stop increasing after the month you turn 70 years old. So yeah, all you do is, and this is not automatic. People are missing benefits out there because they think that when they turn 70, it's maxed out on their own record and then you'll be switched over automatically. It ain't automatic. So the local offices are supposed to send out letters and tell people that there's more money on their own record, but unfortunately, because of staffing issues and everything, they missed the ball, unfortunately, a lot. So yep, continue to receive your surviving spouse benefits. Keep an eye on your own work record. Go into socialsecurity.gov, set up a My Social Security account. Make sure your earnings record on your own record is correct because that's how they're going to determine how much benefits you make for the rest of your life. And then say, oh, okay, at 62, I'm going to make $1,000 more on my own. So at 62, I'll just jump on my own. So, or at 67, I'll make, $2,000 more, or at 70, I'll make, $3,000, whatever the case may be. So whenever is good for you, just jump over onto your own record. So simple, 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 simple. And again, it's not automatic. So. All right, let's get back to the live questions here. Investigative journalism is sidelined. The journalists who research it will find a hard time publishing and they end up having to live outside the United States. Yeah, I'm afraid, there's going to be kind of voluntary censorship out there because people are going to be hesitant to talk about this stuff. And I hate those Medicare Advantage commercials they bombard us with. Yes. And, there was, some starship captains and some football players and some comedians. Remember those commercials that always came around September, October, November and stuff? They made a lot of regulations to limit those. They can't use the Medicare logo pretending that they're Medicare. They can only talk about benefits that are available in that area. That was a common, bait and switch where they said, hey, call us. There's a $300 card out there. This is notorious for all things Facebook and everything nowadays. So I love, Bella, I love my Medicare Advantage Dual Complete Plan. Yes. So there you go. And if you have a dual complete plan, which are the dual eligible plans, you can't get a Medicare supplement even if you wanted one. So, but remember, Bella already knows this because she's a regular viewer. You love your plan this year, doesn't matter. Your plan expires midnight, December 31st. And January 1st, a new plan takes its place. You'll have maybe the same card and the same doctors and the same company and the same monthly premium, zero. But all of the little details under there can very well change. Those Medicare Advantage plans, the prescription drug plans, they're only good for 1 year. 1 year. So when you do it. So that's why it's important that you need to kind of check those on a yearly basis and make sure you're still in the best one. And then the Medicare supplement plans, those are good. You know, pretty much they're, once you get an N was last year and was this year, and it'll be the same next year. But you can also change those anytime you want. If you're in a G that's starting to cost you a lot of money, 365 days of the year, you can switch to another G or an N or something like that. You might have to go through health underwriting, depending on your particular state, but you can change that anytime. Morgan, why do 75-year-olds who did without as a child now have to give up their retirement? Yeah, not sure what you're referencing there, but yeah, let me know. And or you can go onto my website and make a video question. How do you do that? You go onto my website, mygovexpert.com, and unfortunately, my little thing cuts it off there. But on the bottom left, you can't see it, but you go to mygovexpert.com there, and on the bottom left, it has a little camera icon. You press that, and you can record a little video. So, and when you record a video, make sure you shut my video off in the background so we don't get all that feedback, and so I don't have to sit there and listen to myself talk. I hate my voice over this, but anyway, there's that. Jojo Gore, sounds like the other story about the dead people collecting and the 300-year-olds. Yes, yes. Another distraction. You know, you notice they didn't find $1 given to these people that are 120 years old receiving Social Security benefits because they weren't receiving Social Security benefits. I said that on day one. And it's interesting, I guess Elon Musk, you know, he was the big, you know, perpetuator of that misinformation. He was even saying that, you know, non-citizens, you know, were, you know, getting benefits, implying that people that are in this country illegally are, you know, receiving benefits. And he just posted a thing yesterday in X that says, hey, these people aren't receiving. It's like he's kind of saw the light when it's to his advantage. So I'm not exactly sure what the heck. Yeah. So my brother suggested that I could get TRICARE for our parents, but I don't know if they have it in Nevada. I looked it up, but I can't find information about TRICARE. Yeah, TRICARE is if your parents were in the military. So it's retired military. If your father or mother were retired military, then they should already be eligible for TRICARE. So yeah, if so, reach out to the VA there at Nellis or the Michael Callahan, you know, hospital out there in North Las Vegas or wherever the case may be. But Medicare, that's a whole different thing. If you have TRICARE, you also need Medicare. Nancy, okay, I'm leaving. Can't stand someone in here debating why and how we like someone. It's okay. All right. So we got some trolls coming in here. Sorry about that. This is live. It's just me. I don't have anybody monitoring the question. Sometime I pay the price for that because I don't read the question before I put it on the screen. I just put it on the screen and read it at the same time you see it. So every now and then, yeah, he gets me in trouble. But hey, we're 100% live and unplugged here. So, and as part of that, we get some idiots in here as well. So what are you going to do? So the Medicare or Medicaid program has to be fair. If not, that $1 million for the could be our and the most part for our lawyer. Yeah, they definitely need to be fair there. Yes, obviously. Okay, well, I'm over an hour here and run out of time. I apologize. I will be back again tomorrow, answer a bunch of your questions. I love those video questions, so keep those video questions coming in. And I will answer a bunch more tomorrow. And y'all have an awesome, awesome night. And please, please, please take care of each other.